How's it going? Girls from Mold Clinic. Well, I want to show you some sequences of how botulinum toxin is applied so that we can understand the vocabulary used in the world of botulinum toxin or Botox, and how we doctors refer to each thing so you can better understand the topic of duration, and how we doctors refer to each thing, and so you can better understand the topic of duration. When do you get a touch-up? When you don't get a touch-up, how often should you apply botulinum toxin, etc.? Let's remember that Botox or botulinum toxin is the most commonly performed treatment in the world of aesthetic medicine. I mean, more than 50 or 60% of the treatments a doctor does in their office, it's going to be botulinum toxin. Botox is the most commonly performed treatment. Botox is a very simple application. It is applied through injections in the face. The pain, let's say on a scale from 0 to 10, if we measure the pain, the reality is that the pain is very, very low. I mean, it's very close to a 0.1 or 0.2. About pain, so don't be afraid. Apply botulinum toxin without any problem. On the other hand, let's say that botulinum toxin is applied today, and that is the application on day 0. And from there, we generally start counting about 12, 13, 14 days. In general, let's round it to about 15 days, give or take 2 days. So it can be from day 13 to day 16, 17, 18, the follow-up. And you go back to the doctor for your botulinum toxin follow-up to see how it turned out. If one eyebrow is a little higher than the other, or if it affected one side more than the other, don't worry. Talk to the doctor who gave you the treatment. Don't go to someone else because you'll spend more. They'll charge you, etc., etc. Open that line of communication with the doctor who is treating you and talk to them during the follow-up. How do you feel? This doctor will, at their discretion, I mean, the decision is up to the doctor to apply a touch-up. The decision is not up to the patient, because patients typically always want more and more and more, thinking that it will last longer or that it will work better for them, and that's not how it works. Typically, they always want more and more and more, thinking it will last longer or thinking it will hold them better, and this is not the case. If we apply more without any justification, what we do is increase the side effects, which is something we don't want, and that doctors have to be careful about. So, at the doctor's discretion, touch-up can be done at 14, 15, or 16 days. Until then, the application remains. Obviously, this touch-up will have its beneficial effects after about 5 to 7 days when you start to see the effects of the touch-up. That's where the application ends. Obviously, this touch-up will have its beneficial effects after about 5 to 7 days when you start to see the results of the touch-up. That way, you'll be able to enjoy the toxin. All the brands say up to 6 months, but pay attention to the keyword, up to 6 months. The reality is that the toxin hardly lasts 6 months. It lasts 5, it lasts 4. In some cases, the toxin lasts even up to 3 months. And then, after about 3.5 to 4 months, we can give a new application of the toxin. It's not that a touch-up is done at 4 months. New application of toxin. It's not that a touch-up is done at 4 months. Okay? So a new application is done at 4, 5, or 6 months when the patient needs it. And then we start counting the 15 days again for a follow-up with the doctor. And once again, it's at the doctor's discretion to apply a touch-up or not. A doctor, typically, an experienced doctor meaning someone who has been practicing for more than 2 or 3 years. By frequently applying botulinum toxin, this doctor will have enough experience to say that out of every 10 patients, 9 are left satisfied, 8 or 9 patients are left happy. And generally, 1 or 2 touch-ups, 1 or 2 patients will require that touch-up during their follow-up. The reality is that the other 8 or 9 patients, we just check them. Everything is fine. All right, go home. If the patient has had more than 4, 5, or 6 applications of botulinum toxin, she already knows herself, she knows what she wants, and she even evaluates herself in the mirror, so it's no longer necessary for her to go to the doctor. Or the other way around, they evaluate themselves in the mirror and say, oh yes, I need a little more on this side because I can still move my eyebrow on that side. And then they go to the doctor. And these patients know themselves so well that they tell the doctor, what I need more of is right here, right? And as a doctor, I check her, and indeed we were missing 1 or 2 more units of botulinum toxin. Well, hope you like these videos. Let me know in the comments what topics you're interested in for me to make videos about, and of course to give you more valuable information. Thank you very much, and I look forward to seeing you at Mold Clinic.